First, I congratulate the organizers in organizing this event at an appropriate time and on appropriate theme, and for providing a platform for interaction and exchange of ideas to all the professionals, researchers, students, NGOs, and environmentalists working in the field of science and technology and management. Climate change is not a new phenomenon. It is happened in the past due to changes in solar irradiance and volcanic eruptions. There is close coherence between the changes in temperature and greenhouse gases during the last 4 lakh years. The coherence is particularly marked during the periods of rapid warming at the end of each period of glaciations. During this century, increase in greenhouse gases, particularly carbon dioxide, due to industrialization has emerged as the dominant climate forcing mechanism. IPCC recommends the stabilization of carbon dioxide levels at 450 ppm in order to limit the temperature rise to 2 degrees Celsius. It is interesting to observe that the major changes in the existing environment or climate is caused by the indiscriminate actions of modern civilizations or the sophisticated, intelligent mankind without thinking about the repercussions more than the actions. It is documented that by 2050, the world will have 50% more people than now, meeting the demands of the population growth, which is a big enough problem, is compounded by the adverse consequences of the climate change. According to the International Food Policy Research Institute, the climate change will hit South Asia and Sub-Saharan Africa the hardest through falling crop yields. This would lead to food shortages and soaring prices for staples such as rice, wheat, maize, and soya beans. These consequences are further complicated by the loss of farmland due to rising sea levels, rise in the number of insects and plant diseases, and changes in glacial melts and river flow. IFPRI estimates that the children of 2050 will have fewer calories to eat than those in 2000, making child malnutrition a major issue. From the published reports, it is evident that the changing global climate is already affecting infectious disease transmission patterns, and these changes are expected to greatly impact human health as surface temperature rises, agricultural belt shift, extreme weather events.